My name is Vanessa. I'm the Health and Education Manager for TENI. And as part of our strategic plan launch, we are talking to a number of different trans people around Ireland in terms of our experience. This one, we're going to speak to the wonderful Noah Halpin in terms of transgender healthcare, which certainly when we're doing our review and asking the community throughout the country in terms of their experiences, the main experience that came to the fore was accessing healthcare. And, I'm well aware of the situation, that it's ongoing. We're very, and my heart is pumping out of my chest even talking about that, because we continuously get communications from people and family members in terms of blocks and obstacles to accessing healthcare. So today we're very, very lucky to have Noah Halpin, who also set up the wonderful organization, advocate organization, the ThisIsMe campaign. So good morning, Noah. How's things?
Good morning, Vanessa. I'm grand. I'm doing all right. How are you doing?
I'm grand. I'm absolutely the finest, I have to say, down in Waterford. What part of the world are you in?
I'm in North County Dublin at the minute. I'm staying in my parents' house for a few days after I've just had a spinal surgery, so they're looking after me for a few days, and then it's back into the city centre now soon enough.
Oh God, well, fair play to you, and thanks a million for coming on, especially after surgery. Yeah, and maybe we'll even start. I mean, your experience then, if you've just had surgery, you've just come out of hospital. What was your experience then? Maybe what's the importance in relation to trans healthcare, not just specifically in terms of trans healthcare, but the experience of a trans man having a non-trans specific service in the health service. What was that like for you, Noah?
Well, like Vanessa, I know you know yourself, trans healthcare isn't specific to trans-specific healthcare. Trans healthcare isn't
Everything.
The HRT or gender affirmation surgeries or procedures. It spans across every area of healthcare. And I have to say, the hospital that I was in was generally good. When it came to my trans identity, I guess it did fall down a couple of times where, as a trans man, insisting on, pregnancy tests, when I kind of said, look, I'm refusing that, I'm a man, I don't need to provide one. Things such as, and thankfully for the Gender Recognition Act, I was able to have Noah Halpin and male on my hospital ID bracelet. But, it comes to a point where, if anything below the belt came into play, anything such as, catheterizations or suppositories, they'd insist on female nurses doing it because, in their minds, biologically, I wasn't considered a male. And that was something I did challenge, and they did understand. So, trans healthcare doesn't just mean, trans-specific healthcare. And it was something that I explained that, every time I need to have help, having a wash, you don't need to send in specifically female nurses because of, the body parts you assume I might have. Overall, I had, generally a good experience. Just when it came to little things like that, it was a little bit difficult.
Yeah, absolutely. So it sounds to me that there's quite a lot in that. And certainly in terms of when you're trying to recover, if you are experiencing that underlying and chronic stress in terms of how you're going to be addressed in here and how you're going to be addressed from day to day, on top of your recovery. And we all know that chronic stress is a negative aspect of trying to recover. So, it's really incumbent on our health service and the Department of Health and our government to ensure that, yes, we have specific trans-related healthcare services that are based on international best practice, but also our whole health service are well equipped and well trained in terms of delivering a first-class service to trans people across the health service.
Yeah, and being educated in trans identities, even if you don't work specifically in the field of trans-specific healthcare. I mean, I was put into a private room as opposed to, because the wards are gendered, and I specifically said I wouldn't be put into a female ward because, number one, I wasn't female, and number two, I didn't want any women in those wards to feel uncomfortable with my presence if they might be having some sensitive needs too. So it seemed like, you know, their best solution to this was to put me in a private room altogether, which I mean, it's always nice to have a private room in a hospital, but not for the reasons that I got it. But you know yourself, you know, trans-specific healthcare is something in Ireland that it's so difficult to access. It's much more difficult than it needs to be. And, you know, every study will prove that once obtained, it dramatically improves the lives of trans people in Ireland, which is why we need to dramatically improve access to healthcare for trans people.
Absolutely. As you mentioned, the studies that are very much there. Our service seems to be lacking in terms of following on from peer-reviewed articles and the current studies that are out there, which would look at timely access to trans-related healthcare does improve the quality of life. Whereas if you're looking at a 2-year waiting list, at least a 2-year waiting list, it negatively impacts the quality of life for trans people. By the time that we access that service, our mental health and physical health has deteriorated. So again, coming back to your situation with chronic stress in the hospital, that this ongoing stress of trying to access a service is really impacting us negatively. So by the time we access it, we're in a much negative position than we would have been when we initially looked to access it. So that's a brilliant point, and thank you for making that.
You know, and you know, another thing to add to that is that, you know, we know that when people are forced to wait for trans-specific treatment, when people are forced to wait long periods of time, you know, for treatment that helps them become the person that they are, you know, all that time waiting is only, you know, increasing mental health difficulties and physical difficulties. And, you know, even by the time we're seen, we're often told that, you know, you're too mentally unstable to be put on treatment, when in fact being put on treatment is going to do nothing but improve our mental health by you know, creating a situation where we're being given the tools to become our authentic selves. You know, oftentimes improves our mental health and our physical health tenfold. And you know, using those maybe anxiety issues that could have been developed whilst waiting for treatment, you know, as some sort of tool to deny or delay treatment is only damaging people further. And if treatment is delayed or denied and not providing any support following that, is going to further send people down a path of depression and anxiety. So, you know, by providing timely and adequate healthcare can only improve lives. You know, it can't cause any harm by treating people appropriately.
100%. And again, I suppose in relation to my earlier conversation with Jamie earlier from Cork, and she raised the situation not all people who come out or are identifying as trans will need medical interventions or surgical interventions. And that's a point well made by Jamie. But also in terms of, and that you just mentioned there, if there is them regionally developed services, which have been suggested by the Quality Improvement Division in the HSE in 2016 paper, that if we had that hub and spoke model, that we would have that regional services in all area, and they could do them earlier assessments. They could give that earlier support to trans people. If there is that waiting time to access a service that's based in Dublin, at least you could still access the support in Donegal, in Listowel, in Meath, in whatever area of Ireland that you're in. So the goal has to be, and very much in our strategic plan, that we would we keep delivering them trainings, which we already are, not in the middle of a pandemic, of course, although we've had given some online trainings to people that were open to that. But
Well,
we have to educate people throughout the country to enable them to provide that service to us in a regional basis at early stages.
and you know, Vanessa, you're absolutely right. And one of my, I'm sure you know, one of my biggest gripes with the trans healthcare service in Ireland is that it's Dublin centric, that we have one central clinic that is trying to serve, you know, trans people all over the country. I think, you know, one of the last statistics I heard was there's over 50,000 gender variant people in this country. And to have one Dublin centric clinic, you know, looking after that many tens of thousands of people, of course it's creating waiting lists of 2 years. If we can use the education that TENI is providing to healthcare professionals all over the country and give them the tools to be able to look after trans people regionally, rural I can never say that word, rurally, we don't need to force trans people to be traveling cross country to get a treatment that GPs provide to cisgender people every single day. Hormone replacement therapy is something that is provided to maybe, you know, women going through menopause every day, maybe some cisgendered men who are low in testosterone. It's a pretty regular treatment that is, you know, levels are monitored the same way, administration is the same. GPs know how to do this, but they need the tools and education on how to do this when dealing with a trans patient. And TENI are doing wonderful work in that they're educating, you know, doctors and nurses and admin staff, you know, all over the country. We just need more uptake on it. Unfortunately, it's not something that's compulsory for healthcare providers, but we need healthcare providers all over the country to take TENI up on that training and to be open and willing to learn about how they can help us. If we can get clinics and healthcare providers all over the country, that's half the battle. That's half the battle against waiting lists. It's half the battle against having people to travel, maybe people who don't or are uncomfortable traveling long distances, or people who just aren't comfortable maybe leaving their house in general. It is such a big, big challenge for people to have to travel to one Dublin-centric clinic. But by providing education to health professionals all over the country, we can get rid of a lot of the problems that we're having in the system. We can get rid of a lot of waiting lists. I mean, we have psychiatrists all over the country who are capable of being able to say that this person is suffering from gender dysphoria, but why is there only one that we can go to? We have got surgeons all over the country that can provide double mastectomies or, you know, breast enlargement. We have surgeons all over the country who can do this. But why aren't they doing it for trans people? And it's education. It's all education based, you know.
Absolutely, yeah. And I think, you know, I think you're again spot on. I think just a couple of points there. I think in terms of, I think the national service that has been developed is probably built around a couple of people with lots of experience there in that area, whereas HICWA's national standards for better, safer healthcare would recommend that it's built around the community rather than the consultants. So I think that's where we need to be moving with that in terms of HICWA's approach to how we provide a service to people with the community at the center of that model rather than the service providers.
Community healthcare is always better than a hospital setting. Trans people aren't sick. We don't need to be treated in hospital settings. Community-based healthcare is exactly what trans people need. We are not sick. We do not need to go to hospitals for our care. Community-based healthcare is number one. And, you know, in order to be able to do that, one of our biggest challenges, as you well know, Vanessa, is the model of care being used. And a model of care that's outdated, that, you know, we're stuck in the dark ages. And it's that model of care that we're using that is stopping our healthcare from being able to be put out into the community. It's a model of care that, has been disproven. It goes against all international best practice standards of care by WPATH. I don't know why we're still using it, but once we can fix that, then we can branch out into community-based healthcare, and that is the healthiest way forward for transgender people and the care of transgender people.
100%. No, I think the key points here are our government, the Department of Health, and HSE, who we have a lot of support in certain areas, but we'd like to see more movement in terms of how that model of care that was developed without any consultation from the transgender community is addressed, because we can't I mean, like, many trans people don't want to access that. They don't want to wait 2 years, and they want to access a model of care that is not based on international best practice and has never been consulted on with our community. So that's the key thing. I suppose, just to kind of finish up on, and you've already alluded to the trainings, and I must say it's really difficult for me, because one of my favorite parts of my job is delivering trainings to health professionals. And although it's not been mandatory, the numbers of health professionals who have contacted us throughout the years looking for training is really, really encouraging to see. And the support that we've had to develop a 3-day training package called Gender Identity Skills Training. So that the support that we've had from the HSE in developing that, and we are the only model in the world that has this 3-day training package. So the objective of this training is to have them regionally trained, exactly what you've said, that regionally trained people in community settings that can provide healthcare to trans people. Of course, the GIST training, we would have between 60 and 80 people on it. It's a very high level training. We've had 200 applicants last year. We could only accept 80. Similarly, this year we're not sure with coronavirus, but we do plan to have it, and it is planned to go ahead on the end of November this year. So going forward, yes, it is training. Yes, it is information. Yes, it is education, and it comes back to our strategic plan, which we're very, very proud to have. That we have the community support. That we're going through this together. This is not, we've heard this over and over again during coronavirus and COVID-19. It's like, we're going through this together, and it's such a pleasure for me and a privilege for me to talk to you yourself this morning, that has made so many changes in terms of trans healthcare and in terms of bringing in the community. So thank you.
I want to thank you, Vanessa, for all the work that you've done over many years and the differences that you have made to so many trans lives. Even if you don't know that you've made them, you absolutely have. And you know what made me smile, and a lot of health professionals won't, is that it wasn't this time around that I was in hospital. It was the last time I was in for the same issue. I said something about they asked what medication you're on, and I said, oh, I'm on testosterone. And they were like, oh, I said, well, actually, and she goes, you don't need to explain. I went to one of the education sessions with TENI. You don't need to explain anything to me. I completely understand. And that made me feel safe, and that made me feel comfortable. So the more medical professionals that take TENI up on the offer of training that you are providing to them makes all the difference when they end up dealing with the trans patient in the hospital for unrelated reasons. And for them just to say to a trans person, you don't need to explain to me, I understand, makes us feel so much more comfortable and so much safer in the care that we're getting. So thank you for what you're doing, what you've continued to do for years. And thank you for everything you're doing for the trans community.
It's a pleasure and a privilege, and thank you. And you have the last word. Thank you. Well done, Noah.
Have a good rest of your day.
You too. Talk to you soon. Mind yourself.
Bye.